Pranita, and today I'll be demonstrating how to draw up 2 different insulins in one syringe. For this skills video, we'll be needing gloves, a sharps box, hand sanitizer, the 2 types of insulins that we're using, NPH, the intermediate acting insulin, and regular insulin. We'll be needing gauze, alcohol pads, and a insulin syringe, which is 29 gauge, 0.5 inch needle and 100 units, and we'll need our patient. The first thing we're going to do is verify the physician orders on the EHR, or the electronic health record. Next, we'll verify the 6 rights of medication, which is the right patient, the right medication or drug, the right dose, time, route, and right documentation. After that's been completed, we'll verify the physician order to the MAR. The physician order states to administer 4 units of regular insulin subcutaneously alongside 8 units of NPH, which is intermediate acting insulin, subcutaneously prior to breakfast. Now that we have verified the medication and the orders, we can gather our supplies and go meet the patient. We'll knock on the patient's door. The patient will let us in. We'll close the door to ensure patient privacy. I'll perform hand hygiene. I'll introduce myself to the patient. Hi, my name is Pranita and I will be your nurse. Next, I will verify the patient identity using 2 patient identifiers. May you please verify your name and date of birth? I will check if the information is correct on the wristlet that they wear. Next, I'll ask the patient if they have any allergies to medications, foods, or substances. In this case, the patient has denied. I will then inform the patient the reason for my visit, which is to administer insulin as prescribed by their healthcare provider prior to breakfast every day. I will explain to the patient that insulin helps in treating diabetes. It helps for glucose to enter cells to expend energy. Insulin does have some side effects such as nausea and dizziness, but it does have severe side effects such as hypoglycemia, which is low blood sugar, or hives, which can indicate that the patient is allergic to the medication. I'll also inform the patient that when I administer the medication, the injection site might have some burning or stinging to the area, which is completely normal and will resolve. Do you have any questions for me? The patient has no questions for me. I will then bring in the nurse to help verify that the order is correct, that we'll be administering 4 units of regular insulin and 8 units of NPH, or intermediate acting insulin. The nurse has confirmed and reviewed over the MAR. Thank you so much for your help, nurse. Now I will perform hand hygiene. I will apply my gloves on. I will get my alcohol swab and I will swab the top of the vials of each insulin. While we wait for the tops of the vials to dry, I'll open up my insulin syringe. I will set the syringe at 8 units with the cap on. I will remove the cap. Next, I will place the syringe into the NPH vial. We are not drawing up any medication. We are simply releasing the air into the vial. Next, I will draw 4 units, or set the syringe to 4 units, and place the syringe into the regular insulin vial. Again, we are not drawing up medication. We are simply releasing the air into the vial. Next, I will invert the regular insulin vial, and I will draw up 4 units of regular insulin. Okay. I will verify with the MAR. We need 4 units of regular insulin. We're going to obtain another 8 units of NPH insulin, which will give us a total of 12 units of insulin. Now that we have verified with the MAR, I'm checking for any air bubbles, which is good. Next, I will place my syringe inside the NPH vial. And I will invert the NPH vial. And I will set the syringe to draw up to 12 units, indicating that we have 8 units of NPH and 4 units of regular insulin. Perfect. I will check for any air bubbles. It's good. And again, I'll check what them are again. We have 4 units of regular insulin, 8 units of NPH or intermediate acting insulin, giving us a total of 12 units that will be administered to the patient. Next, I'll use the one-hand scooping method to cap the needle. If this was done and the patient is not near bedside, we would label it with the patient's name, the types of insulins that were used, and how much of was drawn out. The next thing we'll do is administer the insulin, and we will then chart our findings of where the site that the insulin was administered, as well as any patient interactions. We'll write down the patient's name, the dose, the medication, time, and any reactions that the patient has received. I will now clean up and I'll remove my gloves. After we administered the medication, and I'll clean up my area. I will thank the patient for their cooperation and letting me take care of them. I will make sure that the patient is in a comfortable position. I will perform hand hygiene, and I will thank the patient again, and I will exit the room.